This is a measure related to pain awareness. And I suspect many of us, particularly as we get older, experience significant pain, frequently debilitating pain. And if you have, you realize how excruciating this can be. It takes away our ability to think, our ability to experience the joy and the opportunities of everyday life. And so this measure will recognize September 2017 as Pain Awareness Month, and in particular, September 22nd as Women in Pain Awareness Month. There are more than 100 million Americans living with chronic pain caused by a number of different diseases and disorders, and nearly 25 million Americans suffer from acute pain annually. People who live with either chronic or acute pain encounter a range of challenges, as I've mentioned, when they are seeking treatment to improve their condition, including pain going untreated or undertreated or improperly treated, because some healthcare professionals, frankly, are still unaware of how to effectively treat pain. In addition to missed medical opportunities to treat pain, people that live with chronic and acute pain also encounter social stigmatization or marginalization. And among the approximately 125 million who live in pain, women are found to have a higher prevalence than men to experience many of the syndromes and diseases associated with chronic or acute pain, and yet their cases are sadly but frequently given less attention, being disregarded as emotional or psychogenic in nature, or because of a general perception that women can endure more pain and their pain does not need to be taken seriously. This resolution would bring awareness to the need to see that these folks, especially women, receive the treatment they need to help with their chronic or acute pain. And with that, and thank you for your attention, I would ask for your aye vote.
Thank you, Senator Jackson. Members, is there any discussion or debate? Senator Stone.
Good morning, Madam President.
Good morning.
It's good to see you. Good morning, members. I would like to rise in support of SR 67. I know the emphasis is that it focuses on pain that women endure. Pain is a nonpartisan issue. It is a non-gender issue. And I'm very proud that in my 34 years of being a pharmacist and owning a very busy compounding pharmacy, our specialty at our pharmacy is pain control. And there are physicians that are specialists in pain control. Usually they get their MD degree, then they usually get an anesthesiology degree, and then they do another residency and become pain control specialists. And we probably wouldn't have the opiate crisis that we have today if those that have significant pain issues would go see some of these pain control specialists that have many tools that are not available to general practitioners in the state of California. As an example, there is a company called Medtronic that developed a very innovative morphine pump that is actually implanted in the abdomen of a patient that has intractable pain. In other words, it has pain that cannot be cured by any surgery or any other medical interventions. And the beauty of these pumps is that they use a much smaller dose of narcotics that actually gets fed into the cerebral spinal fluid, because narcotics work centrally on the brain to reduce pain. And the patient has no control over the delivery of these narcotic solutions that we call cocktails. And the beauty of these pumps is that it keeps people at homeostasis with respect to their pain. They can jog, they can go work out, they can make love, they can do everything that everybody else can do because it creates no physical alterations to their everyday life. They also make devices called neurostimulators that get you actually implanted in the spinal column that alleviate pain. And then there's also a lot of research and development that's going into other drugs that are non-narcotics. A drug called ziconazide, which is an extract from a poisonous snail where the venom is fatal to a human being, but when they use the venom in a very dilute concentration in these pumps, it actually alleviates pain without any addiction. So, Madam President, pain is real, and we have to address it in a very thoughtful way. There are professionals out there that deal with this. I commend the author and the floor jockey for bringing this forward and highly support SR 67 for these reasons.
Thank you, Senator Stone. Members on the floor, thank you very much for your attentiveness. If we can get the back of chambers to quiet down a little bit, that would be very helpful. Thank you. Senator Gaines.
Yeah, thank you, Madam President. Members, I just wanted to embrace and discuss this issue and how important it is, and want to thank the good senator for bringing this forward in terms of a different way to practice medicine, and that we really haven't understood for decades and decades how to deal with pain management in the right way. And I've actually learned a lot about this through my mom and dad, who have been involved with the Pain Institute in the Sacramento area here. And how do you treat pain, chronic pain that people suffer for years and years? And so just wanted to support this and thank the good senator for bringing it forward.
Thank you, Senator Gaines. Senator Pan.
Thank you, Madam President. Senators, I would like to thank my good friend from Santa Barbara for bringing up this very important resolution. I think it does also highlight some of the challenges we have as we try to make policy here in this House and on the floor, and then how does that operationalize in the front lines? When you have someone coming in pain to see you as a physician, you have to try to figure out how do we strike the right balance in terms of providing treatment to alleviate that pain. At the same time, of course, if the pain is so severe that you have to consider treatments such as opioids, the risk of addiction as we're facing our opioid crisis. So I hope that as we think about our policies in terms of pain and addiction, that we think carefully that our policies, both, of course, we want to halt the opioid crisis and addiction, but also that we want to be sure people can get pain relief. So again, it's something that is, we need to be sure we keep both sides in mind, because sometimes the pendulum tends to swing one way and then the pendulum swings the other way, but hopefully we can keep a sense of balance and be sure we keep that sense of balance so that people can get the access to the care they need. Thank you, and I urge an aye vote on the support resolution.
Thank you, Senator Pan. Seeing no further discussion or debate, Senator Jackson, would you like to close?
Thank you very much, Madam President, and I appreciate the comments of our colleagues, and particularly statements that are made in the context of how do we address pain and not over-address the use of opioids, and I think that is the challenge. But, there is pain out there, and I think the particular references I was referring to, women in pain, because we don't necessarily understand a lot of this, when women present with pain, frequently it's underappreciated. So I think of an illness like fibromyalgia, for example, which is a very real illness, but we can't quite figure it out. And it also is probably 90 or 95% seen in women. And I know people who are literally debilitated, cannot get out of bed. And for years, because we couldn't figure out what it was, we just assumed, well, these women were just hypochondriacs. On the other hand, we have people who claim they're in a lot of pain, and what they want is the opioids. So I think what's important about this measure is that we recognize that this is a real problem that truly affects human beings. At the same time, we have to be thoughtful, intelligent, and well-informed in how we address it. And with that, I would ask for your aye vote.
Thank you, Senator Jackson. Mr. Secretary, please call the roll.
Allen. Aye. Anderson. Aye. Atkins. Aye. Bates. Bell. Aye. Berryhill. Aye. Bradford. Aye. Cannella. Aye. De Leon. Aye. Dodd. Aye. Fuller. I Gaines. I Galgiani. I Glazer. I Hernandez. I Hertzberg. I Hill. I Hueso. Jackson. I Lara. I Leva. I McGuire. I Mendoza. I Mitchell. I Monning. I Morlock. I Morrell. I Newman. I Wynn. I Nilsson. I Pan. I Porcentino. I Roth. I Skinner. I Stern. Stone. I Vidak. I Wachowski. I Wiener. I Wilk. Bates. I Stern. Hueso, I.
Hueso, aye. Ayes 40, no 0. The resolution is adopted.